Welcome to another video. In this video, we will continue learning respiratory medications starting with beta-2 adrenergic agonists. Respiratory medications are used to treat chronic inflammatory conditions caused by asthma, bronchitis, and emphysema. Treatment for chronic respiratory disorders often includes multiple drug therapies. When administered as inhalation therapies, the following guidelines should be implemented. This is a must-know. Advise the patient to take the beta-2 agonist before the inhaled glucocorticoid to increase steroid absorption. Here are instructions on how to use an inhaler correctly. Remove the mouthpiece. If appropriate for the medication, shake the container. Stand up or sit upright, exhale deeply. Place the mouthpiece between the teeth and close lips around tightly. While breathing in, press down the inhaler to activate and release the medication. Continue breathing in slowly for several more seconds. Advise the client to use slow, long, steady inhalation. Hold breath for 5 to 10 seconds. And the end, perform frequent mouth care. Now that we know how to teach the proper use of an inhaler, let's learn about beta-2 adrenergic agonists. The action of this medication is to promote bronchodilation by activating beta-2 receptors in bronchial smooth muscle. The airways of the lungs relax and dilate to promote optimal oxygenation, making it easier to breathe. Common used medications include albuterol, salmeterol, and terbutaline. What's the difference between albuterol and salmeterol? Well, albuterol is a short-acting beta-2 adrenergic and is used for acute asthma attacks, while salmeterol is long-acting and is used more for the prevention of asthma attacks. General precautions and interactions. These medications are contraindicated for clients with tachydysrhythmias. They should also be used in caution if the client has diabetes mellitus, hyperthyroidism, heart disease, hypertension, and angina. If the client is taking beta blockers, note that this will reduce effects. MAOIs will increase effects. General side and adverse effects include the following: tachycardia, palpitations, tremors. What is the most important client education? Teach the client to be careful using salmeterol more frequently than every 12 hours. This ends the short lesson on beta-2 adrenergic agonists. Let's now learn about methylxanthines. The action of this class of medication is to promote the relaxation of bronchial smooth muscle, resulting in bronchodilation. One important key point to remember is that methylxanthines are caffeine derivatives, so when thinking of side effects, think of how caffeine affects us. The two main medications to remember in the methylxanthines class are aminophylline and theophylline. Methylxanthines are used for relief of bronchospasm, such as COPD patients, and long-term control of asthma. Now, what are the precautions to know with this medication? Note that this class of medication is contraindicated with active peptic ulcer disease because methylxanthines are known to stimulate peptic acid secretion. Also use with caution for clients that have diabetes mellitus, hyperthyroidism, heart disease, hypertension, and angina. Never mix with parenteral form with other medications. Note that phenobarbital and phenytoin decrease theophylline levels. Side and adverse effects include irritability and restlessness. What are signs that a client is having a toxic effect of this medication? Signs will include tachycardia, tachypnea, and seizures. Okay, now let's go over important nursing interventions and client education. As the nurse, you will want to do the following: monitor therapeutic levels for aminophylline and theophylline. Monitor for signs of toxicity. Teach the client to avoid caffeine intake due to side effects and to also avoid smoking, which will decrease effects of the medication. Also teach that the use of alcohol will increase effects. So you notice that the client is showing signs of toxicity. What do? Here are the steps to help the patient recover from toxic effects. Stop parenteral infusion. Administer activated charcoal to decrease absorption in oral overdose. Administer lidocaine for dysrhythmias. Administer diazepam to control seizures. Well, that's it for this video. In the next video we will continue the lesson by learning about inhaled anticholinergics. Thanks for watching.